move down into the trunk musculature, we often talk a lot about this in Pilates, the powerhouse and some of these common words of the abdominals, and now more recently the transverse abdominis and pelvic floor. What I want to make very clear very early on is that muscles work to support the image of where our body is in space. They typically work subconsciously in what we call subthresholds. So we don't have maximal contractions in our body while we're just moving around through the day to open a door, lift up our child, or lift a bag of groceries. These muscles work synergistically, and the complexity of it sometimes is beyond our ability to describe it, because it's a synergy between some muscles creating stiffness, some creating acceleration, some creating deceleration, some muscles working together to bring a bone closer to another bone and create a stiffness for a preparation for a movement. So it's very complex. What we want to understand is that which muscles are responsible for that local stabilization and which ones are responsible for movement. And if we understand that, then when we're looking at somebody move, we can see when they're over-recruiting or not recruiting enough. And by using some simple landmark cues that we use in Polestar, or some tactile cues, we can get the bony system to start moving in a better relationship. And we trust that the muscle system or the neuromuscular system is going to respond appropriately. And that response appropriately is going to make it very efficient through practice. What I mean by this is that sometimes we get in our own way. I remember very early on practicing and trying to isolate contraction of muscles that we knew were important muscles, but we didn't quite know how to facilitate the movement. So we would facilitate a contraction of the transverse abdominis, a conscious contraction. We later found out that that was not really the most effective way to use that muscle. But that when we organized our rib cage and our pelvis and our spine correctly, guess what worked naturally and easily? The transverse abdominis. So this is going to be the kind of things that we'll be talking about over time, especially with your teachers and the educators working with you to understand the actual movement and how it applies. So let's take a look at some of these muscles. The rectus abdominis is the anterior pillar of our abdominal wall. Its fibers run vertical. It is segmented by fascial connections, and its primary purpose is to accelerate or decelerate flexion and extension of the spine. So when this muscle contracts, it only knows to contract and pull the rib cage down towards the pelvis. If nothing else is happening inside the body to give other direction around the spine, it's just going to close that space. So the rectus abdominis, when it contracts, is going to shorten the anterior pillar of the body. When we look at the other abdominal muscles, we have the oblique, the external and internal oblique. These muscles run in diagonals with the body. We talked about this a little bit in the principle of breath, that the external oblique and the external intercostals run in the same direction as if I was placing my hands into my pockets. So it's a 45-degree angle to the rectus abdominis. Then we have the internal obliques, which is perpendicular or 90 degrees to the external oblique, so just the opposite. And again, 45-degree angle into the rectus abdominis. So we have this beautiful cross on the side of our abdominal wall that connects to the fascia of the rectus abdominis, or that sheath, that anterior pillar. These muscles also connect posteriorly or to the rib cage in the external oblique sense to be able to connect that rib cage to the pelvis more effectively. Now, if I over-recruit any of these muscles, I'm going to lose the balance. So again, going back to the idea that these muscles should be working synergistically and subconsciously to maintain the relationship of the rib cage to the pelvis. Go back to my original cue of drawing the body parts as close to the central axis as the structure permits, right? We pull that in and we draw those bones in towards the center axis. We naturally are using the internal external oblique, and we're also using the rectus and the transverse abdominis and many other muscles that we're probably not even aware of to be able to draw our body into a closer central axis to create that axial length. A muscle that gets a lot of attention these days is the transverse abdominis. And if you notice the fibers of the transverse abdominis, they run horizontal or 90 degrees in relationship to the pillar of the rectus abdominis. These particular muscle fibers do not have a direction of movement on the body like the oblique or the rectus abdominis do. They merely approximate the anterior wall and the posterior wall and draw structure towards the central axis. So it's a very unique property this muscle provides. And in particular, it is a predecessor muscle or a preparatory muscle for organization of movement. So often the transverse abdominis will fire subconsciously, subthreshold, in anticipation of a movement of your arm or your legs or bending or moving, just to create enough stiffness of intra-abdominal pressure to be able to be safe and fluid in our movement. If we looked at a horizontal slice of the rectus abdominis and the abdominal wall, we would see something very interesting, especially in the middle slice. If you notice, we talk about the fascial plane that surrounds the pillar of the rectus abdominis. And that fascia, that sheath, is made up of the fascial connection or tendons of the other abdominal muscles. So if we were to go from superficial to deep, the most superficial muscle would be the external oblique. And the external oblique, we said, runs in a 45-degree angle as if the hands were going in the pockets. Okay? And those fibers are going to make up the anterior wall of the rectus abdominis sheath. The internal oblique that runs 90-degree perpendicular to the external oblique is going to come in, and it actually splits its fibers. Half of them go around the front of the rectus abdominis sheath, and the other half go around the posterior, creating an envelope around the muscle of the rectus abdominis, sort of like a jelly-filled packet or a donut. And then the transverse abdominis, coming in horizontally, comes in underneath the internal oblique and also makes up the fascial plane underneath the rectus abdominis. So now you look at the slide and you can see how the rectus belly is enveloped by the fascia coming in from these three muscles. So I want you just to imagine that if you were moving your body through space or swinging a golf club, how these muscles might fire at different times to create just enough stiffness to keep us on that central axis to optimize the movement of our spine in the rotation of a golf swing or in the throwing of a ball or kicking of a soccer ball. Any of these kind of activities, these muscles work synergistically and harmoniously in a very efficient mover. And then in somebody who's been injured, we see just the opposite. We see a loss of the use of these muscles, poorly organized body, and often resulting in injury and compensatory patterns.